Welcome to Counterpoint. I'm Tanya Granick-Allen. Dying on wait lists. It's a phrase no one wants to hear. It suggests deaths that were entirely preventable had we just treated in time. And given all the focus in this past year and a half to stay home and save lives, are we really doing all we can to actually save lives? In the fiscal year 2019 to 2020, at least 2,256 patients died in Canada while waiting for surgery, and 6,202 patients died while waiting for diagnostic scans or appointments with specialists. That's almost 10,000 Canadians. Now, I want to show you this clip in which Judy Anderson, a retired nurse, shares her story of her two daughters, both of whom died while waiting for treatment. Please have a look.
My name is Judy Anderson, and I'm a retired registered nurse, and I live up in Port Perry, Ontario. Shannon's story actually started about 20 years ago when she started exhibiting signs of a family inherited cardiac illness. And eventually she started showing enough signs during her third pregnancy. We went through the route of doing the implantable ICD, so she had a pacemaker defibrillator in for prevention of sudden death. But then she started developing the other part of cardiomyopathy, and that's the congestive heart failure. And it progressed and it progressed, and she was on a lot of different medications for it. At the end of the day, when I took her to the doctors in January, mid-January, it was because she wasn't feeling well, and he said, yes, you've got changes. You might get into this weird particular rhythm called atrial fib. If so, we'll treat it, but because of COVID, you're going to have a 4-week wait in order to get that particular procedure done. Then the cardiologist offered her a second idea. We'll get another opinion. We'll do something called an ablation. So she waited at home to get that phone call from this particular doctor. She waited until the end of February. He told her, he said, it's a year wait. And she was absolutely beside herself. She thought, you know what, Mom, I'm going to die. I feel like I'm on my last legs. She called her children over and had the last minute conversations with them. So that was a Friday. So Friday and Saturday, she kind of said her goodbyes to her family. And Sunday morning, she called the ambulance. She went in. She was admitted. They found multiple things wrong with her at that particular point, depleted levels of potassium and whatnot. Within 24 hours of that admission, she coded. She got a bed in the intensive care unit, and she died 3 days later. They waited far too long, and she knew, she had that premonition that this was the end for her, and it was tragic. You know what, it could have been prevented. Like, see her do what needs to be done, save a life, and it wasn't done.
Shannon's story is truly tragic, but this isn't the first time Judy has experienced family tragedy due to long waiting lists.
My younger daughter, at the age of 10, she had an irregular heart rate. She had a little bit of a murmur. We just happened to take her to a doctor that was dealing with her migraine headaches, and I mentioned to him, I said, you know, I've noticed this murmur or whatever, it's quite different. And being a cardiologist, he examined her, and he came back and he did a whole series of tests on her that day. And he said, this is extremely serious. I'm going to send all these files and information down to Sick Children's Hospital. She needs to be seen right away. We need to get her into the operating room. And he did that. He sent all the files in. He got an answer back saying from Sick Kids, she's not symptomatic enough. She's an active 10-year-old girl, and we'll bring her in when we have the facilities to do that. 2 weeks later, she died of a cardiac arrest putting on her pair of ice skates.
Colin Craig, president of secondstreet.org, joins me now to discuss cases like Judy's and to share his research and findings from his latest policy brief titled Died on a Waiting List. Colin, thanks again for joining me. I mean, I'm just watching that video is deeply, deeply upsetting. She lost two daughters. Is Judy's story unique here in Canada?
No, sadly it's not. And the really unfortunate thing is that we don't really see enough on the part of governments to bring to light information about stories like Judy's. You know, we always see politicians holding press conferences to announce new funding for this in the healthcare system, whether it's hiring staff or building a new hospital or whatever. They like to get the credit end, but they quite often don't like the accountability end, which is to bring to light information on patient suffering. And that's why we've been working as an organization to bring to light stories like Judy's, as well as the data behind it. And her story is not unique. There are lots of other cases where patients have either passed away while waiting for surgery that could save their lives or surgery that could improve their quality of life.
Welcome back. I'm joined with Colin Craig, president of secondstreet.org, who's sharing his research on Canadians who've died on wait lists. And this is a serious topic, and I'm really grateful that you joined me today, Colin. We just heard from a mother who lost not one but two daughters on wait lists. And I mean, it's a devastating story. The first time I saw it brought tears to my eyes. You said this is not a unique situation, that more can be done. So I guess let's dial it back a bit. You know, now in the times of COVID, I feel like everything is brought within that lens of COVID. How are the wait lists with COVID? We hear about longer wait times for MRIs, CTs, all sorts of diagnostics. But was this a crisis before COVID? Was this a thing before COVID?
Yes, absolutely. And if we go back to Judy's story, she talks about losing one daughter before COVID due to excessive waiting periods in the healthcare system. And then more recently, her second daughter that she lost occurred during COVID. So the worst thing that someone can see as a takeaway from what we're observing in healthcare right now is that all these problems are due to COVID. Yes, COVID has exacerbated the problems. It's shined a big spotlight on the weaknesses in our healthcare system, but many of those weaknesses were there long before COVID emerged. And it's really, I think what we're seeing is a giant spotlight on our healthcare system. And if people are paying attention, it's loudly saying we need health reform in this country to help patients.
So when you discuss weaknesses, use this phrase weaknesses, what are the weaknesses? And again, keep COVID aside, and we'll address that in a moment on how that may have exacerbated things. But what are the weaknesses in the Canadian healthcare system? And I don't even know if we can say in the Canadian, because maybe one province is doing better than the other. We have provincial managed and provincial funded healthcare. So where are these weaknesses?
Well, I think there's a few, or more than a few, there's lots, a few that I'll talk about. One of which is, to go back to my point about transparency, governments don't disclose a lot in the way of patient suffering. They require businesses to disclose a lot in the way of workplace accidents. Governments will post online when a private business has a workplace accident, or if they violated a health and safety order. We often see those stories. So that's what they make businesses do when it comes to their own healthcare system and patient suffering. We don't really see a lot in the way of transparency. So the first thing is a greater tracking of the data and transparency, so we know where the problems are. Second, the way governments fund the healthcare system, they cut checks to hospitals and basically say, good luck, we hope you do a lot of services this year. Well, a lot of other countries have found that they can increase output by changing the way that hospitals are funded. So pay them based on their actual output. Now you're incentivizing them to do more hip operations, to do more cataract surgeries and so forth. And both the Fraser Institute and the Montreal Economic Institute have done a lot of really good research in this respect, drawing attention to that change in technique. And then a third thing that I think we need to keep in mind is that countries that have a public healthcare system, but also allow patients choice so that they can go outside of the public healthcare system for services, well, those countries outperform Canada. And so often in this country, your choice is either you wait on a government waiting list for a long period of time for surgery or diagnostic scan, whatever it is, or you have to leave the country. And at the end of the day, that monopolistic approach doesn't serve patients as good as it could be.
Okay, you've brought up three very good points of how we can make things better or where the weaknesses are and perhaps some opportunities. I want to start with the first one that you mentioned, which was reporting. I think that falls under the reporting, that governments don't post the statistics or the stats on what's going on, unlike businesses, you said. So how would a hospital, for example, or a clinic, how would they post stats? What would that look like?
Well, I think the government could require them to report on patient suffering. So it could take into account things like, when did the patient first talk to their doctor about whatever the problem is? How long did it take for them to see a specialist? How long did it take for that surgery to be scheduled? Was the surgery scheduled within the recommended time frame or not? And if the patient passed away, could that procedure have saved their life? could it have improved their quality of life?
So basic analytics, that's what it sounds like to me.
Yeah, exactly. Like just more information on what's actually happening, because behind these numbers are sad stories like Shannon Anderson and what Judy had to go through as a mom, saying goodbye to 2 kids. That's incredible. No parent should have to bury their child. And sadly, Judy's had to do that twice now.
Right.
So there's a lot of really sad stories that are happening, and governments, like I said, they don't bring them to light. They don't want to bring them to light. But if they actually would, I think Canadians would see quite clearly that there's a lot of problems in our system that go well beyond COVID. And we need to have a serious conversation and move forward with serious health reform.
Welcome back. We're discussing secondstreet.org's research, Died on a Waiting List. And it's a terrible topic to have to discuss, but it must be discussed. And based on my conversations with Colin Craig, president of Second Street, it sounds like not enough discussion is happening. And perhaps this is why we see such staggering figures like the one you uncovered. Almost 10,000 Canadians died last year waiting for diagnostics or surgeries or to see an appointment with a specialist. So before the break, we talked about weaknesses in the systems and perhaps opportunities for improvement. We talked about reporting. One of the other components you mentioned is activity-based funding. And I think I've seen similar models maybe in the United States. You know, as a Canadian living close to the border, sometimes we see American advertisements or American channels coming over the airwaves. And I always notice that certain clinics or certain hospitals will say, we're the #1 in hip replacements, or if you need a cataract surgery, we've been ranked this for cataracts in the Eastern Seaboard or something of the sort. Is this the kind of model you're suggesting where we have more specializing of different surgeries and funding following that?
Yeah, it certainly could be. I mean, you could have give patients the choice between going to a private provider or even within the public healthcare system. But I think what activity-based funding looks at in terms of a hospital context is saying to a hospital, we're going to give you X amount of money for every, say, hip procedure that you complete. So now that hospital has the incentive to try to complete more hip procedures. And if someone knocks on their door and they have a legitimate need for a hip procedure, well, the hospital is going to want to welcome them. Whereas right now, what we often see in healthcare in Canada is you get towards the end of that funding year, and if that hospital is running low on cash, then they want to make those patients wait until the following year.
Oh.
So it's a completely different approach to healthcare, and it doesn't mean that you have to spend more. It's just you spend more smartly. And then what you're doing is you're completely changing the way that hospital operates so that it's focused on output rather than some of the distractions that we see sometimes right now that hospitals get engaged in.
Now, I know earlier this year, you and I were chatting of other Canadians who died on wait lists. And in some cases, it sounded like there were not enough operating rooms available or surgical times available for that hospital. Would something like activity-based funding alleviate that? Or is this an example, rather, of not having activity-based funding?
Well, I think it certainly could if you combine it with other options, and that one would be to sort of take the handcuffs off of private healthcare in this country. So again, you keep the public healthcare system so that anyone can use that system if they want. But if you give patients more choice and you have more non-government healthcare providers, then maybe a patient decides they'd like to go to one of those clinics to get their hip done or to get their heart looked at or whatever the case is. And ultimately what you end up with are more healthcare resources for Canadians to use. There's more healthcare resources in the system. And this was actually a problem with COVID, is that governments across the country said, hey, we're going to stop all these other procedures and we're going to focus all our efforts on COVID. Well, that's because they had fewer resources compared to other countries to begin with to fight COVID. We have fewer hospital beds per capita, as one example, fewer doctors per capita compared to many other developed nations. So we're having to really ration these resources whereas other countries where they have that dual system, where you have public and private, they have more resources to begin with. So you end up with less patient suffering in those other models.
And, you know, I was speaking to some friends in the United States and in California. They would always comment that, well, you have so few ICU beds. No wonder you're at capacity with a small spike in COVID. You know, we have, with our private healthcare system, like we have so much capacity, and you guys just need to build up capacity. but there are only so many dollars to go around. So it's interesting you mentioned about non-government clinics and perhaps some element of private healthcare, but immediately critics will suggest, well, you're advocating for a two-tier system. And ultimately, those with resources will be able to access better healthcare than those without. How do you respond to something like that?
Well, that's the great fallacy. People with resources right now, does anyone really think that they're sitting and waiting on a government waiting list? No, they're flying to the United States for healthcare. They're driving over the border. They're going well beyond the US to Europe. We've talked to patients who have gone to Mexico and China, like Canadians who are desperate. They're living in chronic pain. They will go abroad for healthcare. And it's not just the wealthy. There's a lot of middle-class people that we've talked to that have gone abroad. We interviewed a nurse from Nova Scotia who worked in the system. She could not get the care that she needed in Canada to fix her back problems. So she got on an airplane and she flew to Mexico. And, after she had that surgery, immediately she felt less pain. She was on the road to recovery. She was doing much, much better. So, this idea that we're somehow going to prevent two-tier, we're not doing it right now. And ultimately, it will help all patients if you have more options in the system, because some people will decide to pay out of pocket.
Welcome back. We're examining the issue of dying on wait lists in Canada, waiting for specialist diagnostics, or even just to see a specialist, or surgery rather. Well, joining me is Colin Craig, president of secondstreet.org. Colin, is there a province or territory that's doing a better job at keeping patients alive? Or is there very little difference province to province when we look at things in the lens of dying on wait lists?
That's a great question. I think every patient wants to know the answer. We certainly want to know the answer too. But the problem is that the data is really not good across the country. And what I mean by that is that we have enough data to see that there's a problem, but so many different health bodies just simply don't track the data, or they say track half of the information, but not all of the information. So it makes it really hard to compare province to province. I'll talk about Nova Scotia for a moment. Their government does a very good job with tracking the data when it comes to surgical deaths. The problem is that their numbers just aren't good in terms of if you're a patient. They noted that in 2020, 30 patients passed away while waiting for surgeries, which potentially could have saved their lives. And of those 30, about 2/3 of them had waited longer than the recommended timeframes. So that's obviously some pretty sad news. And I don't want to leave your listeners with the wrong view, or with the wrong impression, rather. A lot of these cases that we've identified are for patients waiting for surgeries and procedures, which it doesn't seem like that would have saved their life, but it would have improved their quality of life. So a great example is cataract surgery. In the province of Saskatchewan, about half of their patient deaths were for cataract surgery. But if you think about this on a human level, would you want to spend your final days waiting potentially a year or longer for cataract surgery, all the while you're walking around with cloudy vision? I mean, that's no way to spend your final days on this planet. So there's a lot of cases like that where patients would have been living in pain, they would have been suffering, they would have had anxiety because they would have been worried about a particular health problem getting worse. And I would just note that all of the data that we received from governments, we've posted it on our website so that viewers can go in and take a look at the data for themselves.
Okay, we have only 2 minutes left, and this has been a very interesting program. Many Canadians, or some Canadians might suggest, well, we have a socialized healthcare system. There's only so much money that can be spent. We only have so much money to go around. It's not uncommon, even in private healthcare in systems, that people die on wait lists. Sometimes people just die and things get triaged. How do you respond to that?
I think we need to focus on the fact, too, that patients don't have a choice in this country. That's the big difference between Canada and the rest of the industrialized world. There's no other industrialized country where the government does not allow you to spend your own money on health procedures that could help you. Canada does that. In so many parts of this country, you cannot use your own money to get a hip operation so that you can have that quality of life in your final days, whatever the case is. So that's one thing that really differentiates us from the rest of the world. again, we're seeing so many examples of patient suffering, and they don't have that choice, and that's I think a big problem. When you look at the data overall, we see that Canadians suffer under waiting lists more so than other developed nations, and that's a problem. So I think, reform, like I say, it can mean that we continue to keep that aspect of Canada's healthcare system that Canadians seem to love, and that is the universal aspect. Whether you're rich or poor, you have access to a public system. We can keep that in place, but we can reform things so that patients have more choice, so that the public system does a better job. Right. So that it's more focused. There's a hospital in Windsor, Ontario, where they've been losing money running a Tim Hortons. Well, for goodness sakes, if we start to look at health reform, we can change it so that we're not seeing those types of wasteful examples, so that those dollars could instead be used to help provide services for patients. Certainly. Ultimately, health reform can improve outcomes for patients, and I think that's the most important takeaway that we all need to think about.
Colin Craig, always a pleasure speaking with you. Thank you so much for this information.
Thanks a lot for having me, Tanya.
Take care. Of course, every system of healthcare will have its pros and cons, but when we see statistics like this, numbers that nearly 10,000 Canadians died last year on a wait list for something so routine as a diagnostic procedure or surgery or seeing a specialist, it really is quite jarring. We know not everybody always can be saved or treated the best in a healthcare system. You want that, but it's not always going to happen. But shouldn't we strive just a little bit harder to do just that much better? For Counterpoint, I'm Tanya Granick-Allen.